Welcome to the Cornell Veterinary Podcast, where we deep dive into the discovery, care, and learning that happens at Cornell University's College of Veterinary Medicine. I am your host, Dr. Michelle Moyal, visiting assistant clinical professor and lover of the ugly sweater. Thank you, Cornell. With me today is Dr. Chris Frye, who is the section chief of Sports Medicine and the Rehabilitation Service at the Cornell University Hospital for Animals, which we will get to. We're going to explain all of these really cool things. He's also a Cornell vet alumni class of 2011. I hear 2007 was really where it's at, but 2011, seems okay. But 07 is where it's at. But yeah, I'm very excited to have you here. And I'm really excited on two fronts. So I'm excited on the Cornell front, and we'll kind of deep dive into that because I love finding out more about the Cornell experience for people when they went to school. But I'm really excited because in addition to acting as host, I get to wear my other professional hat, which hopefully won't flatten my hair too much. A metaphorical hat, if you will. I will be wearing my other professional hat as a veterinary communications manager at Purina. And so I'm very excited because you and I will be talking today about an amazing collaboration between Purina and Cornell that I want the world to know about. And it's called the Cornell Canine Healthy Aging and Mobility Program. We love us some acronyms in veterinary medicine. So it is called the CHAMP program, right? I guess I'm repeating that P. But the goal is to help older dogs live longer and healthy lives. So that was a lot. Welcome to the show, Dr. Frye.
Thanks, Dr. Moyal. Glad to be here.
And feel free to call me Michelle, but we're going to get right into it because I'm excited. And before we even start, because I will ask you about your journey to get to Cornell or get back to Cornell, I would love our listeners to know, what the heck happens in a sports medicine and rehabilitation program? What does that mean for people with pets?
That's a great question. Actually, it's a fairly new specialty. It's very similar to human sports medicine in that our primary goal really is to improve function, physical function of our pets and their mobility. We do this through various means, which includes physical therapy, pain control, or pain management, as you want to say, weight control and weight management through nutrition, joint supplementation for things like osteoarthritis, or other supplementation for options like growing muscle, things like that. So optimal nutrition, you could consider that type of thing. And we put together these plans for our pets, and I'm going to use the word holistic manner because we kind of consider everything. If they have comorbidities or other diseases that need to be treated, surgeries that are warranted, we will recommend pursuing those as well as part of the plan. And the idea is to optimize their function and get them back to the goals that our families want them to achieve. So it could be for a geriatric dog, it might be something very simple like going on 10-minute walks,
stairs.
Going upstairs, even in and out of the home.
Apartments. Yeah.
Yeah. Navigating small obstacles on the floor can be challenging, or slippery floors.
Absolutely.
And then for other patients, we see a lot of athletes, canine athletes, agility dog population, dock diving, and maybe an injury has occurred with those patients. And through medical management or through a combination of medical and surgical management, we try to get them perhaps back to sport.
Ooh, I love that. So here's what I'm hearing. You play a part of this team that essentially helps our pets. And maybe these pets have had surgery. Maybe they have, when you said comorbidities, just other diseases that they're taking medications for. Maybe they have arthritis and they're taking medications. They're having trouble walking, but it could be any animal from the trouble walking just at home, or they want to go for a walk with the children in the house, to a working dog or a hunting dog or an agility dog, because their agility is very serious. They have champion agility dogs.
Yeah.
Which is so cool to watch.
Yeah,
so
it
cool
is.
To watch.
It's fun.
My dog is what? Why would I? I'm on the couch. It's great. So for my dog, it would be, could he jump onto the couch and off the couch in between naps? So that's what I'm hearing. But that's really awesome. And here's the other thing that I'm really excited to hear about. In veterinary medicine, it's nice to hear that veterinarians, no matter where they are in veterinary medicine, are thinking about pain and are thinking about holistic approaches, because we have a lot of clients, like when I was in practice, a lot of clients that maybe wanted to explore supplements to help their pet. Maybe they didn't want to rely as heavily on medication. So I love that you're thinking about that. That's really exciting.
Yeah, we really try. It's funny that the terminology out there, you could say we're integrative in that we try to integrate different approaches, or you could say we're holistic. And the terminology, the term holistic just means all encompassing. Shouldn't all medicine, I always think, shouldn't all medicine be holistic? Taking into account, it's not necessarily, when we go see our own doctors, we're going there for a very specific reason. And that's typically the only thing there's time to address. But some family practitioners and things like that take into account the whole body and mind, actually. So, really improving welfare all along the spectrum, which feeds into this CHAMP program nicely. When we think about healthy aging, we think about it's along that entire line of aging from for dogs from the time you're a puppy to the time you're an adult and then through your geriatric years. And at each one of those time points, it's really about optimizing and maximizing your health level through nutrition and exercise. Preventative programs like vaccinations are helpful in young dogs and even in older dogs. And if you do acquire a disease over time, as most aging pets and people do, it's about identifying those diseases and then treat them to the best of our ability and to minimize their impacts. And so by doing so, you increase both quality and longevity. So quality of life and longevity improve. And so the CHAMP program is really about that, with more of a focus on mobility, because mobility is such an integral part of what we consider a high quality of life for both dogs and people. And so that's kind of how this program came about, and that's our mission. And I think what we're doing in veterinary medicine now is trailing and catching up a little bit to some of our human counterparts here on these missions.
That's really interesting. I think human medicine is really highly specialized. And even though you're very much an expert and a specialist in this field, you're still focused on whole pet. And I think what people don't realize is long life is great, but we want long, good life. So we want pets that can still walk well. We want them to enjoy their time, as it links back to the mind, right? Because pets have anxiety too, just like people. And if they can't walk, it's also very stressful. Or if they're in chronic pain, it's very, very stressful. And so, okay, I'm going to jump around. So the goals for you with this CHAMP initiative are what? What will you do with this? Because this is a really awesome collaboration.
Well, we would like to actually perform research that helps us define exactly what healthy aging is in our canine population. That actually really hasn't been done yet.
Wow.
And there are differences in opinions, and it might depend partly on the pet and the family that has that particular pet. There are limitations in veterinary medicine. Some are in acquiring medical care or having access to medical care.
Absolutely. We've talked about that here a lot.
Yeah. There can be financial limitations, geographical limitations. Sometimes for our dogs, we even find there's limitations in climate. I mean, when it's very cold out or icy, it's slippery. These dogs are more affected if they have severe mobility issues. So
no kidding.
Right?
For anybody watching, aging.
Oh, man.
Sorry about that. But my knees today were no.
Oh,
no,
yeah.
lady. Yeah.
It's fun, isn't it? Yes.
Yeah, I love getting
all
old.
we can do is I have to stop eating a second dinner myself. I mean, that's really where I could start in my own.
Darn it.
So that's kind of what we're looking to do. And I think some major things we already know and is that obesity or prevalence of obesity in dogs is a huge issue. It's been an issue for a while. And we already have research showing that if we can maintain healthy body weights, dogs live longer and better. So that's a perfect example. So getting that information to owners at an early age is part of the preventative medicine strategy. Those things happen before my patients reach me, right? I'm typically seeing these dogs much later. Sometimes I'll see puppies for severe hip issues and other problems, but most of the time we're seeing them as older geriatrics here. They're heavy, they have mobility issues, they have a lot of osteoarthritis. Sometimes they have neurological issues that compound it. And, we end up putting them on weight loss diets. But it would have been more ideal to have that information provided to owners with an idea of what we should strive for in our pets and why at earlier ages. And I know veterinarians, it's a constant battle.
A constant battle. Doctor, I'm here to give a shout out to all general practitioners who have talked about this for years and years and years. And here's what I think is cool. And I want to bring this up because it again, Purina had us on. They happened to do one of the longest studies, right? So the lifespan study, essentially following dogs throughout their lives. And you guys can Google lifespan study. Go online. And they found that a dog, in this case, let's say a lab, could live almost 2 years longer if they were lean. Now, in practice, I had people who would come up to me and say, Dr. Moyal, someone at the dog park came up to me and said I was starving my dog because my dog is thin. And I would be like, your dog is perfect. Don't touch your dog. Like, your dog is perfect. So we have people like outside influences talking about people saying their animals are too thin. And then, we have social media, which I love me a hashtag chunky cat. Right? But it's not good for them, right? So you as the expert, I would let's just have you say that one more time. Much easier to keep off weight than it is to lose weight, correct?
Yeah, it really is. And especially if you have small children, like mine who drop food all the time.
Food from the heavens. Just
food from the heavens for those pets. And, oftentimes we think food is love. And especially when you're on certain breeds like the Labrador.
Beagles, I'm looking at you.
Beagles too, yeah, for sure. And so, what else can we do with our pets to show them love? And there's many, many things, and I think activity is one of them. And so, here's a big question: what level of activity should dogs be pursuing throughout their life? And that has never been investigated.
Wow.
Which I find fascinating. It's a challenging thing to investigate, but it would be a worthwhile one, I believe. And how much does activity play? We know it plays a huge role in human health. How much does it play in animal health? And it would be wonderful to have that data at some point. And it plays right in part with CHAMP. So
that's neat. I mean, I'm just reading more and more articles that on the human side, even 10 minutes of walking significantly impacts human health. So We're saying that we really don't have any of this information on the animal side. And that is what you and this CHAMP program really want to look into.
That's part of the mission.
Yeah.
Pain control is part of the mission. Identifying disease is part of the mission.
When you say disease, what do you mean?
Sorry. A lot of patients come to me with musculoskeletal disease. It could be neurological. It could be
so nerve problems, muscle problems, arthritis. Gotcha.
Yep. And in veterinary medicine, we have not really explored and defined soft tissue injury that well. And I think part of the problem is we don't have a great way of easily diagnosing it in most common practices. So, humans go in and they have a complaint, their lower back pain, their biceps tendon hurts, and they can get their MRI. They might get x-rays. They might then get sent to MRI. Just the other day, I had to have an MRI of my knee. My knee hurt, had prior surgery 20 years ago for my ACL ligament. And they did x-rays. It didn't look terrible. And then they did an MRI and it doesn't look great. So, but it showed I had a meniscal tear. So I think that being able to more readily identify and understand the prevalence of soft tissue injury in various dogs would be great, whether they're athletes, older animals, things like that. That'd be something I'd like to look into.
I love that. And if you tie that into what you mentioned before with access to care, Like, not everybody who brings their dog in for limping can afford an MRI or a CT scan. And a lot of people don't realize that it requires general anesthesia or heavy sedation sometimes in animals. And that's like scary for people. I would be scared, as a non-professional in this profession. I totally understand that. So maybe if you can get some clues, you can help the veterinarians like me who are out there just in general practice, seeing that initial limping dog.
Yeah, actually, we just published recently a method to use ultrasound to visualize the inner shoulder compartment. Some of those ligaments are often torn or diseased in dogs that can cause lameness. So there are methods that you can teach potentially in general practice by exploring them here in academia.
That is so awesome. And that's, ultrasound now is pretty readily available for a lot of veterinarians in practice. And so that's so neat. Okay. So that's an important, this program sounds like it's going to do great things. And that's a really important goal and a really important mission. And kind of, I do want to ask you a couple more things, but just wondering, like, how did you get to where you are? Like, for someone who didn't even know that sports medicine was a thing in veterinary medicine, they might know the journey of going to vet school, like get good grades, go to college, do some things, volunteer at a vet hospital. But how did you get to be where you are? Like, did you always want to do rehabilitation? And like, now you're like the section chief, which is like awesome. And so can you just tell us quickly how you got there?
Yeah, a lot of my life is just complete accident.
Love that. We hear that a lot, and it's the same. We hear that a ton here.
Dude, yeah. So I think, I wanted to be a veterinarian for a long time, and then I went through a period of uncertainty, and I came back to it. So I taught kids for a while on sciences and things like that, and then I came back to go to veterinary school eventually. I didn't even know specialist medicine existed in the veterinary community until I became a student. I had no idea that there were veterinary cardiologists or veterinary surgeons. And I went through the program here, and I went and practiced in private practice as what people would consider a primary care. I was more of a general practitioner, I suppose, who they do everything, right? So, you do surgery, you do emergency, you do everything. And so you're kind of a jack of all trades. And then I was given an opportunity to come back to Cornell. I had an interest in nutrition, pretty heavy interest in nutrition. I felt it was something that wasn't explored well and really incredibly important. And I think you can attest to this. When you're in general practice, you get so many questions about what should I feed my dog? And it's something that we could really be more heavily involved in veterinary medicine. So I thought, hey, I'm going to explore this more. Came back to Cornell to do a residency. And the residency was really combined nutrition with sports medicine originally. And Purina actually helped fund that residency, which is interesting. And I'm very grateful for them for that. I sat out there since we're doing this, and
they love that. You heard that, Purina. You heard that.
I'm sure. Yeah. No. But it was. Their interest in improving dog nutrition and dog science and medicine is really incredible. So I ended up, and now here's where Purina is not going to be. So I didn't even pursue the nutrition residency after all that.
Wait a second.
Yeah, sorry. And then I found kind of more my interest in orthopedic medicine, which is really, sports medicine is mainly orthopedic and neurologic medicine that's non-surgical.
Yep.
And working with those patients and improving their lives. And really, what we do is help identify causes of lameness through diagnostic workups.
So lameness meaning limping of any kind.
Yeah.
Front legs, back legs. Gotcha.
Yep. Slowing down, limping. It could be sudden and acute, or it could be something slow and progressive or chronic.
Gotcha.
And so we'll look at anything really without a diagnosis and help gain a diagnosis. And then based on that, we can decide, hey, are there surgical options, medical options, or a combination of things that we can use? And what other holistic approaches can we implement here, whether it's weight loss and nutrition, joint supplementation, I do a lot of interventional pain control. So as opposed to kind of traditional pain control, which might consist of daily pills, anti-inflammatory drugs, which can have some adverse systemic effects, we try to kind of get
meaning
a precise...
like vomiting, upset stomach, not eating, right? Sometimes bloody poop. No one wants bloody poop in their house.
They don't. And those medications are great.
Yes, that doesn't take away from the fact that they do work. Not every animal has those issues. People listening, they can really help.
They're actually fantastic medications, but sometimes you need something to either augment it or, if there is adverse effects, to replace it or decrease how frequently we use it to minimize those adverse effects. And so we'll do, finding the exact diagnosis might allow me to do something like a therapeutic joint injection with medications or orthobiologics like platelet-rich plasma or stem cells. Or sometimes we'll do injections near nerves that are impinged with corticosteroids or epidurals and things like that. So there are different methods to implement these interventional pain strategies, and we usually do it with imaging guidance.
That's so cool. So essentially, you use like ultrasound or something, and a joint is painful, or the pain is coming from the fact that there's something wrong with a nerve, and you're doing stuff like, people, they use a lot of what's called trigger point, right? So you can inject pain medication, or in this case, a steroid is not something that will make the dog look great on stage or at the beach. It will make it will help the dog with inflammation. So you'll be able to put that in there, and then you get to use other really cool things like platelet-rich plasma. Google. This is very exciting, everyone. This used to be such new technology like 10 years ago, and now it's something that we hear all the time, which is so neat because they do a lot of joint injections on the human side. And you get to do that now and help repair, potentially like allow for healing in the joint itself.
Yeah, a lot of the platelet-rich plasma, or we run a stem cell laboratory here too with FDA approval, of course. A lot of those, we call them orthobiologics because they're biological products that help treat a disease, usually to encourage healing or reduce pain. Those are the two kind of main purposes. And when we provide them for a joint with osteoarthritis, we don't think we're going to cure or regrow cartilage at this point.
Yeah.
But we do know that they have a lot of local effects through cell signaling and immune system modulation that can reduce inflammation and pain.
Wow. So the injection can help tell the immune system to like cut some of that stuff out. I almost cursed, people. I almost cursed. Like cut that inflammation out and can help them be more mobile.
Yeah.
That's incredible. And I think
they're relatively safe, which is nice.
Which is really nice and less invasive than some things, right? Like there are a lot of invasive procedures that I know a lot of people are worried about, especially in older pets. Now, again, when they're warranted, they're warranted. But if this could be something that could be tried and can really help. And I think sometimes this is a really nice, thank you for mentioning, Purina's role in funding a residency. I think sometimes people think that pet food companies are just there to sell pet food. Now, I do understand that. But really, like we have a motto like your pet, our passion. And having worked there even for a short period of time, I really, really have come to understand the love that Purina has for pets. So of course we want pets eating like our complete and balanced diets, and we're like so thoughtful and like science, yay. But we try to help and collaborate with experts like you to help make things like the CHAMP program, because we want pets to live longer, healthier lives. And that just like makes me so happy. It just makes me so happy to hear, because I don't want people to be like, oh, it's just pet food. It's not just pet food, because, and I don't know if you know this about me, actually, I graduated from college with a degree in human dietetics.
No.
Yeah. So I studied to be a human dietitian. So I love nutrition. And I talked a lot about nutrition as a primary care provider. And it can be a struggle talking to people about nutrition. And I'm sure no one knows better than you, because there are a lot of things on the market. Sometimes there's like new things every day. I get a sponsored ad for like something I've never even heard of. It's like, Anne's new dog food. Anne made it herself. I'm like, who's Anne? Right? Like, who is Anne? And so, so I'm really glad you brought that up. So thank you for that.
Oh, yeah, you're welcome. Now, I think it's very evident to me after many years of working alongside folks at Purina, that they really truly are indebted to that mission. They're driven. And I think that company philosophy makes, I mean, you could speak more to this, would make for a very positive working environment. And I think people are really passionate about what they do there. And it gives meaning beyond what one would imagine a typical company would have. So.
Thanks for that. And I do want to tell people listening, because we have, and I'm sure you've talked to previous students, I think sometimes students graduate as veterinarians and maybe they are not a researcher, or maybe they like research, but they don't want to be specifically in a lab, right? Or maybe they find that clinical practice is not for them, but they love veterinary medicine. And so I didn't know that a position like this was available. So I'm part of a team of veterinarians, and literally I get to help talk to students. Like, I train students on nutrition. I get to talk to doctors and just let them know the innovations that we offer. So like being on the forefront of innovations to help animals, like, is big hearts. Big hearts, does it? Well, okay. Yeah, big hearts. Oh, hey, big hearts.
Wow. Let's see if I can do that.
Yeah.
Nah, mine doesn't work.
That was little special effects here on the Cornell Veterinary Podcast. And so I'm going to keep going because I can get distracted by, like, hearts and stuff. But I've heard you created something really interesting, but of course it's got another acronym because, again, we love us some acronyms in veterinary medicine. You created something called the TUG Test, TUG. Also with Purina support. Thanks, Purina. But can you tell me what the heck that is? Like, what is that?
Yeah. That's a great question. So one thing we really lack in veterinary medicine is what we call functional testing. So in human medicine, they have an array of different types of validated functional tests.
Validated meaning like a bunch of people did it and said, yes, this actually does prove either way if there's an issue?
Yeah, there's different, actually, that's also another very good question, Dr. Moyal. There's different ways to validate a test. So a test needs to be reliable, mainly, right? So does a test have value? Does it show you what you want to see? So that's one question. So that's called criterion validity. So if I...
And this is why I'm not a researcher at all, people. Just so everybody knows.
And the other thing is that a test has to be, repeatable. So, if you do a test, it can't be all over the board every time you do it, or its value is not very meaningful, right? So when we're validating this timed up and go, that's what the TUG stands for, timed up and go test.
Timed up and go.
It's derived from human medicine, where they time a person getting up out of a chair, walking a short distance, turning around and coming back and sitting back down in the chair. And so a test like that, it looks at gait or walking gait. It looks at your ability to get up, your balance and spatial awareness, and even a bit of your cognitive functions, your ability to understand what the task is at hand and perform it. And so you can take a test like that, say in a geriatric population, and it might tell you things like, are they more likely to fall? Or how long should you be hospitalized longer in rehabilitation, or what your prognosis is and things like that. And that's been explored on multiple fronts in human medicine and in various populations with such a simple test. Okay. And so we took a similar idea and created our own test. Dogs are very challenging because you can't say, all right, Fluffy, I've never seen you before and I've never trained you for this particular task, no matter how smart the dog is. And I'm going to put you in an unusual environment. I'm going to ask you to perform some things for me, and we're going to measure them and assume that you're going to get a consistent result. So for example,
strangers will touch you. You're going to be in a new place that's not your home. You're already older. You might even be in pain because your joints aren't working appropriately, or you have some conditions going on. So, okay. Yep. Easy. Sounds so easy. Okay.
Very easy. Yeah. So we spent a lot of time over the years here trying to figure out what what tests are important? So what are they measuring? So I think balance is important.
Yeah.
The ability to navigate obstacles. I think in an older dog, the ability to get up from a down position is so important, right? Some dogs
Down
really
meaning
struggle to get
laying
up.
all the way down or just sitting butt on the ground?
Both are important, but
Yeah.
our focus was laying down because dogs
Yeah.
will sleep and then they have to get up in the morning.
Yeah.
And geriatrics dogs do a lot of sleeping. We know that, just like
Yeah.
just like my father. So, I
I
got to be
love
able to
me
get
some
up.
naps though, people,
Yeah, exactly.
when I have the chance to take them.
I do too. I'm
I
not
would
going to
love
lie.
that. Yeah.
The kids prevent me from ever sleeping now. But so we took some ideas, navigating obstacles on a floor, getting up from a down position in a repeated fashion, and getting up from a down position and walking 10 body lengths and timing it, so we looked at all these tests, scientifically speaking, and we found that the only reliable test that was really that if we had two people independently observing and rating the test was the timed up and go. And that test also demonstrated validity by correlating very nicely to pain and functional scores. So the slower you are at doing this test, getting up from a laying down position and moving 10 body lengths, the more likely you are to be painful or have lack of mobility based on these prior validated scoring scales. So that's how we started to validate it. And we had a large group of dogs to do it. And now we're looking at repeatability. So is this test, if I repeated the test 3 times in one session, or if I repeated the test maybe today and 3 weeks later, do we get similar results? That would be something that's very reliable. And preliminary data right now is very positive. So this is looking like a test that is reliable and repeatable.
That's so neat.
For geriatric function. Yeah.
I can see where that could tie in, and then if they get started on some sort of therapy, no matter what the therapy is, if that time decreases from laying down to getting up, or they do the walk faster. So that's really neat, because we always love, being able to keep an eye on progression, right? So would that be something, so for people at home who have older pets, I used to get a lot in practice, and I'm sure you did too. The dog that struggles to get up or moves really slow, and they just say, well, he's just old.
Yes. So I think in connecting this test to that, I think you're right. This test could not only help identify dogs that were struggling from a mobility standpoint and allow veterinarians to have conversations with owners about potential underlying disease that is affecting their pet's mobility. It can also help objectively, hopefully, look at response to therapy or treatment for mobility-related disease. And it might be prognostic. It might tell us things like, what are the odds that your pet will potentially be hospitalized for various reasons? So that's all, down the road. We don't know. But so those are some of the things they use similar tests for in human medicine. And I think that back to your question now is, can this test be deployed in different environments? The idea is that it can be, and how do we educate our pet families about what the expectations are for their dog as it ages? And the idea is that if they're finding their pet is slowing down, they should find a reason for it, because it may be treatable. And if not, sometimes you can't completely resolve a disease, or cure it, but you can manage it. And that managing improves their quality of life, and it might improve their longevity of life, particularly since we know that decreased mobility is often related to euthanasia and less time with us. So
yeah, no, that's absolutely reasonable. So what I want people, if you're not in the veterinary field to think about is if your dog is having a tough time and they are older, is just stop in and talk to your vet. Maybe there are options. Maybe there are options that they could talk to you about, like medications. Maybe they get to send you to someone like Dr. Frye, who can help you with even more options and do other tests that could help. This is the goal, right? The goal is that in every aspect of veterinary medicine, we can have impact. And it doesn't mean that they have to spend, a ton of money. It was amazing to see that sometimes after I just started an anti-inflammatory medication, how people would come back to me or their dog lost weight. And they would come back to me and be like, I have a new dog. He's 15, but he's acting like he's 6. And that was so amazing. And are these the questions that you hope like the CHAMP program will continue to kind of build on? Like, what are you really excited? Like, if there's what you're like, this is the thing I want. I want to conquer. You're like, I want this. And this is what I want the CHAMP program to do. I would love to use it to answer this or look at this. What's the first thing that comes to your mind?
We lack foundation, to be honest with you.
Yeah. So just that basic info on what animals do as they age.
Yeah, we need to explore. And we should remember too that some breeds and sizes of dogs live different lengths, right?
Yes.
So that makes it a little bit more complicated. Some smaller dogs live in a purse, So, they're the
little teacup Yorkie who may not walk as much.
Right. It may not need to do a flight of stairs, right? So
interesting.
And then we have families who may not be able to lift a heavy dog. Maybe they're older, have mobility impairments themselves. And so we often assign physiotherapy. I would like to explore its effects more. I think that's really important to do. Yeah, we have swimming, underwater treadmill exercises for dogs. We have
also in my feed on TikTok. I'm in a great place on TikTok, kids. Yes.
Targeted strength training. All these things we employ them in human medicine regularly and very importantly, and it's a standard to go see a physiotherapist after surgery. It's often a standard to see a physiotherapist before going to surgery and to attempt that first before going into, say, lower back surgery. So we need that data in dogs and we need to start accumulating it. And so when I think of my main mission is making dogs more functional, and
let's just make it. Wow, he makes his own words.
Or comfortable. I can make that word up. Anything that does that is basically fulfilling the mission for CHAMP. And so I have lots of ideas. I really do.
Yeah.
But I think one could be dogs recovering from back surgery.
That's a huge one. It's a very expensive surgery, and not every dog can walk normally again after back surgery.
Right.
And so this is an investment, and it is neat. And I want to make sure people understand when they listen. Like, you work at an academic institution, but it does not mean you have endless funds to do all of this research so easy. Like, you clearly want to do good things for animals, and we clearly need this foundational information, but it's not always there for you. And that's part of the reason why this collaboration is so neat. Yeah,
we have to procure monies to perform research, whether it's writing grants or partnering. In this particular case for the CHAMP program, it's a beautiful partnership.
Yes.
To help fund within our goals, how to improve pet lives. So for me, it's wonderful. I'm able to do so much more than I ever could with these resources. And I think that's a really wonderful thing for me and other veterinarians who are driven to do that. And then for these pet owners who hopefully will benefit from these endeavors.
I love that. So as the representative with my Purina hat on today, thanks for doing that for pets. And we're really excited to be a part of it. And, I asked you a lot of interesting questions, little science-y questions. And now I like to jump into what I call a little bit of a lightning round, just like a get to know you. So that way, when people email you and they're like, I heard you on the podcast, you sound pretty interesting. They've got some info.
I've got 2 kids. I do nothing.
You do nothing. Okay. So then we'll take it like to sweet or salty.
Oh, salty. Yeah.
Salty. Okay. I like
don't
both,
have much
but
of a
here we
sweet
are.
tooth. Yeah.
Wow.
I know.
Okay. Well, I understand you salty chip eaters. I'm just both. Okay. So I always try to ask a little bit of a question about when you're doing work like on your own. Music, yay or nay?
No, I like to hyper focus with a very quiet environment. Yeah.
Just quiet. So like nothing in the background. That's the way I was actually as a student. And sometimes people were like, Dr. Moyal, there's nothing on. How could you do this? Okay. But when you do listen to a music, what do you put on?
Oh, I listen to like almost everything except maybe heavy metal. I don't do a lot of heavy metal.
Sure.
But yeah,
Is there a go-to group? Go-to group?
No, not right now. No, I do everything. Alternative rock, country. I'll even do some rap. Yeah, I do it all.
Love it. I love the exposure to all the different genres of music. Okay. Oh, well, we talked about this. Star Trek or Star Wars?
This is a great, I love, sadly and geekly, I love both these franchises. I'm going to go Trek, though. There's something very sciencey about Trek compared to Star Wars. Star Wars is more mythical in a way, and Star Trek is a little bit more sciencey, which I like.
There's a lot of science in Star Wars. There's a lot of. I'm not going to get into it.
They do have a lot of hyperdrive difficulties.
Yes.
Yeah. I feel like if the science was good, they would have resolved the hyperdrive difficulties, but they haven't. So I'm just throwing that out there.
You heard it here, folks. That was actually a very valid argument. One last question before I let you go, because this has been so great. Is there one memory that you have where you're like, today was the day I really loved being a veterinarian. Today was the day. Like, I love being a veterinarian every day, but everybody knows there's challenges. There's challenges. There's challenges to any job. But there was like one, and you were like, and you don't have to use the patient's name, but if there was like a patient and you were like, this is where I saw where rehabilitation or sports medicine and nutrition, this made the difference, and this is why like we're changing lives.
I've had a few of those situations where families will contact me, and it could be years down the road.
Wow.
To tell me what a difference that me or my team has made. And that's something that really helps in this profession, I think. And I'm sure it would in any profession. Sometimes I get photographs to hang. And actually right now we are currently hanging photographs of long-term patients of ours up in our working area. And it's wonderful to see them every day. And I think for me, what I love the most is just going and talking to people. Now, normally my residents get to do that now, but I really like just getting to know the people that are coming in and feel value in bringing their pets to me. So it's almost not a particular circumstance, but just kind of a general theme of what kind of keeps me ticking, I suppose.
Yeah. Sounds like veterinary medicine. Just,
Yeah,
awesome.
It's got a different, it's like you were saying earlier, it's got all these different parts to it that I think we can appreciate as people. And I like the different parts to my job. Yeah.
I love that. Thank you so much for being here. For everyone listening, Dr. Frye is the section chief of our Sports Medicine and Rehabilitation Service at the Cornell University Hospital for Animals. Take a gander, Google the CHAMP program. Remember, it's the Cornell Canine Healthy Aging and Mobility Program. Yes, she had to read that off the paper because it's a lot of letters. I'm so excited you were with us for another episode. Please subscribe on any platform you choose, like and rate us, like us a lot. And we will talk to you soon. Thanks for joining us on the Cornell Veterinary Podcast.